Hello, my name's Anita Wluka. I'm an Associate Professor at the Department of Epidemiology and Preventive Medicine, and I'm also a rheumatologist at the Alfred Hospital. I did my PhD at Monash, and when I finished my PhD sometime in the 2000s, we were doing a number of observational studies and randomised controlled clinical trials. And I thought it would be a good opportunity to consolidate my knowledge and keep me interested and up to date. I'm interested in musculoskeletal disease. So what's that? That's back pain, knee pain, foot pain. These are things that are becoming increasingly important as our population ages because they interfere with quality of life and function. So we need to work out how to optimise these. In terms of research outputs, during my PhD I worked at developing and validating methods to measure knee osteoarthritis. In the past we'd used X-rays, which are a really crude way of measuring this. During my PhD we used magnetic resonance imaging, or MRI, to develop really sensitive measures. And these have helped us to understand the pathology of disease, to identify new risk factors, and this information actually informed what's called the Osteoarthritis Initiative, which is a large study with the National Institute of Health and Pharma in America, which was about $10 million that was used to better understand osteoarthritis and its risk factors. At the moment we're performing a number of randomised controlled clinical trials using things that might seem a little bit from left field. So you'd know a lot of people are using fish oil for knee arthritis, but we're not sure whether or not this actually affects the inflammation associated with knee arthritis or whether it affects the progression of disease. So we're doing a clinical trial to examine this. But the thing I'm actually most excited about is the twin study. Bunions. Who's got bunions? Lots of people have bunions, and everybody knows why they get them. Everyone knows they get bunions from their parents or from the shoes they wear. There actually aren't any good studies that examine this, so we did what's called a twin study. We asked 150 pairs of twins, both identical and non-identical twins, to ask them whether they had bunions and to examine the risk factors. And we found that whilst there was a genetic component, it really came down more to the shoes they wore, and not just the shoes they wore when they were children, but the shoes they wore when they were in their 20s and 30s. Arthritis and musculoskeletal conditions are likely to be a national health priority area because they're a major threat to functional independence as our population ages, and they affect quality of life so much. So combating these problems is really important if we're to maintain independence as we age. When I started research, one of my mentors said, you've got to identify a really big problem, something that's unanswerable. And really, in the 1990s, there was nothing we had for osteoarthritis. We didn't really understand the disease either. So developing a new way of measuring disease, which then enabled us to identify the different components of disease, to be able to identify risk factors, was a big problem that seemed unanswerable and insurmountable. But we had a method, and slowly we've been chipping away at it, putting together pieces of the puzzle and slowly developing a better understanding of this condition to facilitate change.